Ladies and gentlemen, on behalf of our colleagues in Hong Kong, I'm going to share with you some of our recent work, as well as our updated understanding about how the environment would interact with child health and development. In the 1960s, Hong Kong used to be called a city of children because of its large number of young population who were energetic and motivated. In the past 4 decades, along with the socio-economic and health advancement, our life expectancy had continued to improve, and now we are among one of the best in the world. But the key question is Hong Kong really so good and such a lovely place for our kids to grow up? During the same period of time, the Gini coefficient also climbs up continuously, signifying increasing socio-economic disparity in this city. When we're looking at the child poverty rate, unfortunately, Hong Kong also ranked number 1 among those most developed regions. In the past 10 years, the proportion of single families, under 5 mortality, and child maltreatment has continued to increase in Hong Kong. Even more alarmingly, children being brought up in a disadvantaged area in Hong Kong have doubled the risk of having premature death than their more wealthy counterparts. By 2010, we still have a lot of children living and studying in very difficult environments, while their wealthier counterparts are spending more than their monthly household income to celebrate on a single party. Ladies and gentlemen, this is Hong Kong. Emerging neuroscience research shows that our brain is not mature at birth and is something that could be changed by early life experience and relationships. How a child turns out is the outcome of the transaction and also the continuous bombardment between the constitution and the environment. Early life adversities, including poverty, poor family functioning, and child maltreatment, would impair our development in childhood, elevate the risk for depression in young adulthood, and increase the chance of suffering from different sorts of cardiovascular diseases at later life. Early life investments have been proven to be the most cost-effective investment in human life. As pointed out by Professor Hedman, longitudinal studies already provide very strong data to show that high-quality education provided to children of disadvantaged families could reduce their risk of developing cardiovascular and metabolic diseases in adulthood. Another key question is, what are we expecting from our children? To become a valuable member of the society, having excellent academic performance alone is not sufficient. Our kids need to have positive development in physical, mental, and emotional aspects as well. Early Development Instrument, EDI, is a useful population measure of school readiness and holistic development of young children. It covers the key dimension of physical well-being, social, emotional, language, and communication skills. Even though the EDI has been widely implemented in different parts of the world, it has never been tested or validated in Chinese communities. Hence, we adapt and validate the Chinese Early Development Instrument in order to investigate the socio-economic gradients in school readiness of Chinese preschool children. During our validation study, we found the Chinese EDI a very reliable tool with good psychometric properties to reflect the holistic development of Chinese children. By using a very stringent stratified random sampling method, children and schools were recruited from the most wealthy and the most disadvantaged district in Hong Kong. Teachers from over 20 kindergartens were invited to receive very comprehensive training on the use of the Chinese EDI and also to assess the holistic development of 567 children. We found a significant difference between districts Children from the most disadvantaged districts have significantly lower school readiness. At individual level, we found the existence of strong socioeconomic gradients in school readiness of Chinese children. For every 1 unit increment of the SES composite score, there would be a parallel increment of 0.7 out of a total of 10 in EDI score. When we categorize the socioeconomic status into different categories, a clear socioeconomic gradient was demonstrated. Children from the more wealthy families have higher school readiness, and they are much less likely to suffer from developmental vulnerability. Key factors at the family and school level were identified which mediate the effect of family SES on school readiness. Family and kindergarten levels each account for around 36% of the total effects. Children from disadvantaged families in Hong Kong could be protected from developmental vulnerabilities if they have positive and good family functioning in terms of frequent parent-child interactions in recreational, reading, and learning activities, and if they have the chance to study in good schools with experienced teachers. That's what we found in our local study. However, this is not the case commonly in Hong Kong. Our poor children usually have poor family functioning, as well as studying in disadvantaged schools, resulting in double jeopardy. Use of digital device has found to be a preference and important issue affecting the school readiness of our local Chinese children. For example, having television in a child's bedroom is associated with lower school readiness, and the ownership of smartphone is associated with low school readiness in physical health and well-being domain. It is interesting to realize that putting a television in your child's bedroom would flatten the socioeconomic gradient in school readiness, even though proper parental control could help to minimize the drop in the EDI score a little bit. On the other hand, sleep has been identified as the most important period of the day affecting growth and development. Although the detrimental effects of sleep deprivation on adolescent health have been well documented, there is still a large knowledge gap on whether sleep would affect the early development of our children. Therefore, we conduct the first study of such on the relationship between sleep duration and the school readiness of preschool children. By using the standard of 11 to 12 hours per day as a standard recommendation, only 11% of preschool children in Hong Kong have sufficient sleep. And almost 20% of them suffer from quite significant sleep deprivation. Even more important, we found those children with sufficient sleep have much higher school readiness over the different domains of the EDI. Those children deprived of sleep have much lower school readiness, in particular in their emotional and language cognitive domains. When we look at the subdomains of the school readiness, children with significant sleep deprivation have much more hyperactivity and inattention, and also a much lower chance of having positive pro-social and helping behavior. When we look at the predictors of sleep duration, we found the sleep duration of our children were positively associated with good family functioning, but negatively associated with the use of digital device. Sleep indeed plays a central role in child development. The less hours children sleep, the lower are their school readiness, and this is particularly true in wealthier families. Sleep deprivation in children increases the risk of vulnerability in school readiness. We follow up this cohort of children in order to understand and study their holistic development and psychosocial well-being. This cohort study is the first of such, which provides the data and allows us to study the existence and magnitude of the socio-economic gap in school success, the extent to which the school readiness of preschoolers at K3 predicts their subsequent school success in P3, and also the extent to which the socio-economic gap observed in kindergarten is attenuated or intensified during formal schooling. This is indeed the first study in Hong Kong to provide longitudinal data on the link between school readiness and kindergarten and academic success in primary school, and also the changes in achievement gap between the rich and the poor. Our preliminary data showed a significant difference in terms of academic performance between the wealthy and the poor districts in Hong Kong. At individual level, we found the family's socio-economic status negatively correlate with both the academic performance in mathematics and Chinese. Families of lower social class and also children from all those disadvantaged families, they have more behavioral problems and less psychosocial well-beings. We also found the Chinese EDI result, in particular in the language and cognitive domain, predicts the subsequent academic performance of the children in primary school very well. Our study also examines the question whether there's any change in the socio-economic gap from K3 kindergarten to primary school P3. The initial socio-economic gap in the school readiness and kindergarten K3 seems to widen significantly when the kids enter into primary school in both mathematics and Chinese performance. As illustrated by this diagram, the socio-economic status predictive value on developmental outcome is increasing over age, signifying that the socio-economic gap is widening as a child grows up in Hong Kong. A group of dedicated professionals had recently met in a WHO meeting in Cambridge to discuss about effective strategies to promote early childhood development. We found not just nutrition and health intervention programs are important. High quality education, and in particular strong family functioning, will also be key determinants of child development. As an example, our team has been recently commissioned by the British government to conduct a rigorous review and a meta-analysis study to evaluate the effectiveness of interventions in promoting early childhood development in the developed countries. In general, we found nutrition supplementation programs were less effective as parenting and child-focused educational programs, while comprehensive programs, which address the different dimensions of development, were the most effective among all to promote cognitive development of children in developing countries. Ladies and gentlemen, promoting child development is certainly a very challenging task. We are looking forward to close collaboration with you all in the near future. Thank you.